if you do Muay Thai, I can guarantee you that your spine is not the way it should be, right? Because it's a very physically demanding activity, right? And there's combat involved. So most likely, what we're gonna do first is I'm gonna check your posture, okay, to see for any postural distortions, which I'm probably gonna find, right? So the posture, the reason why we check your posture is because posture is a window into how straight your spine is, right? And if your head is off, or your shoulders are off, or your hips are off, then I kind of get an idea that your spine is crooked, or what's called subluxated. So a subluxation is basically where a bone falls out of its proper alignment, either through traumas or bad habits, right? And then it puts pressure on a nerve, right? And that pressure on the nerve is what causes the body to stop healing, stop functioning properly, all right? And then from there, we'll further investigate. Okay? All right, so let's have you stand up. And I'm going to have you turn around and face that way. And we're just going to pull your hair back. So we're going to look at your head first to see if it's on straight. So your right, oops, head straight. Your right occiput is higher, so your head is shifted that way a little bit. You look at your shoulders, but this shoulder is higher. So you're getting this and this coming up, which usually comes from your trap. This muscle right here is being overstressed and probably a little bit more tight than the one on the right. Let's go to look at your scapula. So your scapula should be flat against your back, and we can see that we get a little what's called winging, especially on this side. Right, this side, see a little bit, but not as much. Right, this side is pretty deep, okay? Which means your shoulders are not the way they should be. And when we look at you from the side, we can see this left shoulder comes off and rounds a little bit, right? So that's a muscle called your serratus. Right? Your serratus is supposed to hold this flat against itself. So that's not functioning properly. Let's look lower in your hips. So your right hip is a little bit higher than your left. I'm going to look at you from the side, so just keep looking straight ahead. And your ear should line up right in that seam of your shoulder. And you can see your head is a little bit forward. So your head has a little bit what's called a forward carriage, like this. And when that happens, we know that the arc, it's supposed to have an arc right here in your neck. It's called the arc of life. So as the head comes forward, we start to lose that arc in the neck, and it starts to straighten out. Right? If we look at this picture over here, so if you look at this picture, right, we can see a nice arc in your neck. Now once we straighten it out, like that, because we lose that arc, the spinal cord gets stretched, which now causes pressure, and now the signal from the brain going down to the body and out to all your organs get dysfunctional. Let's see what else we got. So because you have a forward head carriage, you have a little bit of an anterior tilt to your pelvis, so it puts a little bit of too much sway in your low back. So you probably get a little bit of pressure right down in this area. And you have a little bit of external rotation. If you look at your feet, your left foot externally rotates a little bit more than the right. So that's our postural assessment, right? So we got some issues that we want to explore. So you're going to turn and face me. So we're going to check range of motion to see if you're able to move normally. And you're going to tuck your chin to your chest, as far down as you can go. And you're going to just pain with any of these. You're going to extend your head all the way back. Okay, back to neutral. You're going to rotate one direction, rotate the other direction. Okay, so we're a little bit limited on right rotation. Come back to the middle. You're going to laterally bend one way, laterally bend the other way, and we're a little limited on left lateral bending. Okay. Any pain with any of that? Okay. So I'm going to check shoulder range of motion. We just do two motions. You're going to first do this, then this, then this, then this. Okay, so turn around so I can measure. Okay. So go ahead. This arm as far back as you can go. Other side. Other side. Okay, so they're about even. And from the underneath. One. Other side. And those are off by about a couple centimeters, right? So you have a little bit less internal rotation on this side. Okay, come on, face me. So we're going to check range of motion on the lower body by having you keep your legs straight, see if you can touch your toes. Very good. Come back up, hands here, and you're going to extend. And that's pretty good. Come back to neutral. You're going to slide your hand down one side of your body, and down the other side. Those seem both okay. And we're going to rotate one direction. We'll rotate the other direction. And we rotate a little bit more going to the left than we do to the right. Okay. Come on over here. And you're going to lie face down. I'm going to check first your range of motion on your quads. So you should be able to touch your butt with this. You can there. Let me check your hip flexor. And that's okay. Check the other side. So it seems like this side's a little bit tighter, right? Can you feel that?
Yep.
So we're a little bit tighter on the left side, which usually comes because the pelvis is shifted. Once the pelvis shifts, the quads get tighter to try and hold it in place. Check right there, and that's okay as well. So I'm going to check your leg length, which will give us an idea of where we're at. And you have a shorter leg. So we have a shorter leg on the left versus the right. Now I know there's something going on in your neck, but we're going to see if your neck can be contributing to your pelvis. So, keep the camera on here. So what you're going to do, turn your head to the right, just your head. And I can see that your legs even out when you turn your head to the right. Turn your head to the left. And then they get shorter again when you turn your head to the left. So it should be easier for you to turn to the right than the left. Is that the case? Yeah.
Yes.
Okay. So we know that we've got some issue that's twisting in your neck that'll also influence your pelvis. So we're going to address this as well as down there. Head back to neutral. All right, so let's see what else we got. Okay, so our pelvis is jammed up on the right side. Alright, you're going to lie face up and check your neck. So that's that bone that we're going to adjust right there. Is that tender at all? That's not where it should be. We call that a subluxation.
Subluxation.
Subluxation. Again, just basically means the bone has fallen out of its proper position and it's causing damage to the surrounding soft tissue, which then causes inflammation, which then causes nerve irritation. And so this whole left side is not exactly where it should be. Alright, so come on up. So what we're going to do is we need to see some x-rays. We need to see it for two main reasons. Number one, I want to see how much damage has been done to your spine. Because you can't feel subluxations until they get so bad that they start irritating surrounding tissues. So an x-ray is going to show us how much damage has been done to your spine already. And the other thing the x-ray is going to show us is the exact position of the bones. So then we can be very specific when we correct it, which means quicker results in a shorter amount of time. Okay?
Okay.
So we're going to spend about 10 minutes on your next visit. We're going to go over your x-rays together, and then we'll go from there. Okay? All right, perfect. So we can, I'm happy